One of the things that here at ECTRIMS, this global international meeting with over 9,000 people focused on MS, one of the things that we're really working on is trying to more effectively treat those people living with MS. So one of the initiatives that was announced here is a survey Genzyme's been doing of over 1,500 people, and including over 1,000 people living with relapsing remitting MS, as well as their care partners, and over 500 care partners, and to really understand how this disease really is affecting people on a day-to-day basis. There are a lot of striking things that came out of the survey. I think one of them is that we're finding that a number of patients understand the importance of going on therapy, so they understand that they want to have less disability and how to prevent disabilities by going on medication, prevent relapses. So I think it was about 83% of people really understand that. The problem is that it's still not translating. So we only found that 41% of people are actually going on medication immediately after being newly diagnosed with relapsing MS. So I think there's a big disconnect. So we got 9,000 people here from all over the world, but it's not translating. So what we need to do is try to figure out what are those obstacles. So one of the things we can do with the survey is try to figure out what obstacles are really preventing people from going on medication, and some of it seems to be from the healthcare providers, and some is just understanding from patients, and then access to care is clearly important. One of the reasons why we started is we definitely see a lot of untreated MS out there. And I think a lot of people are struggling with the disease. So we found in the survey that a lot of people are having troubles with relationships, concerned about, can I start a relationship, can I disclosure, can I stay in a relationship, and what's my future going to be like? I see a lot of people 20s, 30s, 40s, they're worried about employment. And we saw that a lot of people are concerned that they're not going to be able to do as much. We're also seeing issues in terms of bladder dysfunction, sexual dysfunction, and fatigue, and how these symptoms are really present. And I think a lot of people are quiet about these, so they don't come forward to their healthcare providers, their neurologists. So maybe we can take better care for patients by addressing these issues more one-on-one and making sure we're addressing the issues that are really unmet. But I think the biggest thing is I think we have an opportunity to treat early. And I think a lot of people kind of don't dive into these critical issues that are affecting and very important to the people living with MS, and we don't really address those issues. And I think that leads to delay in initiation of appropriate therapy. I think there's a couple of different approaches. There are definitely some people that get diagnosed, they're doing well physically, and they really don't want to share that, and they don't have to. So many times it's their close, friends and family are the only ones that know. They're taking a medication, they're doing everything they want to do, and that's great. And for them, I think that works well. And other people like to be advocates. They like to say, listen, this disease is not what it used to be. So many people are doing well with the disease. But I think what the survey showed you is really there's more people struggling with issues in terms of work and symptoms and relationships that need to really be addressed head on. And I think hopefully this will open the conversation, better communication between providers and those living with MS. I think one of the goals, 85% of people start with relapsing and remitting MS. So I think part of the reason why the focus was there is early opportunity to intervene. Clearly there's about 10 to 15% of people that have primary progressive MS from the onset, and I think we definitely need to focus on their needs, and I think there'll be some exciting news related to that disease course at this meeting. But I think in general, it was trying to get to people earlier, and I think one of the things we talked about is maybe we should go back and look at people in the first 5 years of symptoms of MS and what kind of symptoms they're dealing with. Again, I think let's try to get on top of this disease early on. Let's not wait until people are living with all kinds of symptoms and disability. The dramatic change is I have more patients controlled. So when you have all these different medications, many of the medications work differently. So what it takes to control one person's disease is not what it takes to control another person's disease. And I think, and the other big plus is the tolerability. A lot of people don't take MS medications regularly because they had trouble with tolerability. But when you have so many options, it's less, we find more people are very satisfied with their treatment, not only how well they're responding, but how well they feel on it. And I think that's really kind of the ultimate goal, is to have your disease well controlled, but not the treatment being worse than the disease, which sometimes we had heard in the past. There was actually already a meeting with some of the major patient advocacy groups globally, and with providers, healthcare providers and patients, and really sitting down, like, where should we dive deeper? I think one of the things I'd like to see, and was brought up, was looking at the reasons why only 41% of people are treating relapsing remitting patients when they were diagnosed, when we know how critical it is to change their disease course. So what are those obstacles to treatment? And then maybe ways that we can address the issues with sexual dysfunction, with relationships, and to get people living with MS into get the right resources to those people so that they can make the best decisions for themselves. I think really our goal is to help people live the best lives with MS. There's so many more opportunities now to control the disease, whether it's relapsing remitting disease, and hopefully some positive news at this meeting for primary progressive MS. I think the main thing is to get access to care early, and to get on treatment as early as you can. The survey kind of reflects what I see in my practice, is those people diagnosed early, consistently taking medication. The goal is really to try to change the future for those people living with MS. And hopefully the survey will be a little eye-opening to healthcare providers what we need to do better.